Hey guys, and welcome back to XO Medical Spa. Before I get started on today's episode, I just want to say a big thanks to the End Alzheimer Association. They asked me to be a community lead this year, so please save the date for our October 21st of this year. We're doing a walk here in Irvine, California. So again, save the date, October 21st, 2023. And our personal goal for myself and then also for the practice, I'm trying to raise about $5,000. So that's just a couple bucks from a couple people, and if we have over 1,000 clients here, that's really only $5 per client. And then also all you great people out there in the YouTube world and Instagram as well. So I'll leave a link in the description for our personal donation page. It's completely nonprofit, and with the Alzheimer Association, it's not just towards research, but if you go on their website, it's also to the critical people who take care of our family members, our loved ones. So they give value, reach out. They also give you clinical advice. They also give you service. And then also for the caretakers, you realize that burnout is a big thing that happens when we're taking care of our loved ones, which they have an outreach program for that as well. So save the date, October 21st, 2023, here in Irvine, California. We're doing a walk to end Alzheimer's, and then I'm also a community lead this year. On today's episode, I really want to make things simplistic. I just got off a Zoom, and this patient told me over and over, and she even said it, you probably hear this all the time, but I want to keep it natural. I don't want to go overboard. And she kept reiterating that. But she also said, I know you hear this a lot. And that's a common concern. When you're first starting out, you have no idea what is available, and you don't necessarily know what you're trying to treat. You just look in the mirror and you're like, hey, I'm looking older. And with this patient, she's like, I just hit menopause, and over the past 6 months, I've just been seeing all these changes. But as a client, much like when you're sick, you're like, I feel ill, but I don't know why. That's why you go to the doctors. As a patient, if you're looking older, you're looking more tired, and you're just not looking the way you feel inside, you don't necessarily know why. And that's why you come to us at a medical spa setting. So we can help get you back to where you want to be, and just making you look a little more youthful without making you look unnatural. With first-time clients, I want to make it as safe, as comfortable, and as easy to understand as possible. Because me as a customer, when I go to a auto body shop, when I go to the doctor's office, and if we use the example of the doctor's office, because I'm in the medical field, I have a better understanding. However, there's still stuff that just goes over my head. But I know the questions to ask, and I know how to interpret the care plan. But if I go to like an automobile service and they're throwing all these things, they're like, your carburetor's broken, your oil is empty, your brakes are so-and-so millimeters, I have really absolutely no idea what's going on. So from a customer standpoint, I completely understand all this terminology, and you don't necessarily know what to do to make your car better. You don't know what to do to make you feel healthier. And in the aesthetic world, you don't know what to do to make you look more youthful. So that's why I developed the 3R system, to break it down to its bare bones first principles. 3R stands for reduce, replace, and rejuvenate. And my team will put up a picture here and we'll talk about it together. But I built this 3-tier system, this 3-circle system, so you can break down the 3 stages of aging, and then what we can do in the medical spa setting to reduce the signs of aging and make you look better. So step 1, we want to reduce. We want to reduce the things that make us look older. Wrinkles, pigment, and maybe some other things such as lines, pores, but from the simple standpoint, let's get rid of the wrinkles. So that's step 1, reducing the wrinkles that make us look older. What are they? Here, around our eyes, around our forehead, and maybe some other random wrinkles in this area. But now, how do we reduce that? First step is usually Botox, Dysport, Jeuveau, Xeomin, the newcomer, Daxxify on the list, because we want to reduce the things that cause the wrinkles. Every time we frown, we wrinkle. Every time we lift our forehead, we wrinkle. So we're trying to reduce that. That's step 1. Botox, neurotoxins, reduce the wrinkles. Now we're talking about pores, wrinkles, and fine lines. That's what we're talking about, lasers and texture. So we're using lasers and maybe some other things. I don't want to convolute this, but we're using lasers and other things to smooth down the texture on our face and body. Again, reducing the signs of aging. Step 2 in the 3R system is replace. When we age, we lose volume. We lose bone, we lose fat, we lose collagen, and we lose muscle. If you click in the card description, I've gone over this in multitude of videos where we're trying to replace the volume that we've lost over time. Volume takes away our system that holds us up, our cheeks, our lips, our temples, our jawline, everything that holds us up. All we have left after that is skin. And we live on Earth, gravity takes over, and gravity pulls our skin down. That's why when we age, and clients will tell me this is, it's a genetic thing, I see it in my parents. No, we all age, and we all age roughly the same way. So everything falls forward onto this area, everything falls down onto this area. That's why everything settles, and we get lower and heavier. So let's 3R system. R, replace the volume that's taken away from us. So now we take fillers, any number of fillers, Juvederm, Restylane, more long-term such as Sculptra and Bellafill, but all we're doing is we're replacing the volume. If we have temple loss, our brows fall, reduce that temple loss and we lift. Volume loss in this area, volume loss in our cheeks, replace the volume that time has taken away from us. If we no longer have a jawline, it's not just because the jowls are falling, but because we're losing bone. How many 80, 90-year-old people you know have this hard notching jawline? Because it's bone recession. We lose bone in that area. It rounds you off. So now take fillers and put back what time has taken away from you. If you want to go past that and look even more youthful, we can, but that's how we can reduce the chances of looking unnatural. It has to match you age appropriately. Number 2 in the 3R system is replace the volume that time has taken away from you. And number 3 of the 3R system is rejuvenate. Again, look at the picture that we're showing up here. We've reduced the wrinkles, we've replaced the volume, and lastly, we rejuvenate. What are we rejuvenating? The skin. We've talked about fillers. If you put too much fillers into an older person who has very thin and lax skin, they look unnatural. If you just blow up a patient's lips, but everything else looks around non-rejuvenated, then it doesn't look natural. It has to look age appropriate, has to look sex appropriate, has to look ethnic appropriate. So we're rejuvenating. How do we do that? Rejuvenating is we're gonna lift the skin, and I'm only talking about the face, but we can do this for any parts of the body. We wanna lift, and more importantly, we want to improve collagen and the thickness of the skin. As our skin gets older and ages, it gets very, very thin and becomes lax. It looks like a thin piece of paper. We want to thicken that up to a thick piece of cardboard where it just bounces off. So now we can use PDO threads to help lift and tighten. We can use biostimulators, Sculptra Bellafill, to lift and tighten, or we can use lasers, such as resurfacing lasers, therapy to lift and tighten, thermage, RF microneedling, RF radio frequency to lift and tighten over time. And that's where the rejuvenation comes in. So the 3R system is reduce. We're reducing the signs of aging, pores, lines, wrinkles, texture. Second one, R, replace. We're going to replace the volume that time has taken away from us. We're going to do that with fillers. And lastly, 3R system, rejuvenate. We're going to rejuvenate the skin so you look lifted, higher, more rested, and more importantly, thicken that collagen. That is our proprietary 3R system because we want to break it down where it's something that you can understand and a process that you can follow. Because as a client, you don't necessarily know what's making you look older, but with this system, we can go step by step, but we can also recalibrate and keep going. Once you've hit the 3Rs, now you can go back. We're going to reduce again, then we're going to replace, rejuvenate, back. And we're going to keep doing that circle and keeping you nice, young, and looking healthy. So remember also, Walk to End Alzheimer, save the date, October 21st, 2023. I am a committee lead this year, so I'll be leading my group, and hopefully we can make this the biggest group for the Irvine practice. And then I'm also trying to raise about $5,000. So far we raised about 200 something. We're still in the early stages of it, but if every single one of my clients, every single one of my members on YouTube donates $1 to $5, we've hit that mark. So I'm gonna put a link in the description below and you can donate as yourself. And if you hit a certain donation marker, they'll send you a nice little gift. And remember, it's a nonprofit. All that is tax deductible that you'll get back over time. So I'll see you on the next episode. Bye.